Welcome everyone. Institute of Liver and Biliary Sciences, Department of Anesthesia and Critical Care presents ultrasound guided central venous catheter insertion. Here we are using 7.5 French triple lumen 12.5 centimeters central venous catheter and going to cannulate the right internal jugular vein. The patient position should be supine or Trendelenburg with the opposite side head tilt. The parts are cleaned with the 5% povidone iodine solution and chlorhexidine solution and draped with a sterile drape. The parts of central venous catheter set contains needle, guide wire, blade, dilator and central venous catheter. The ports of the central venous catheter are flushed with heparinase saline and 3 ways are connected if necessary. The parts are draped with the sterile drape and ultrasound probe is handled with the sterile camera cover. Now the structures are visualized through the ultrasound probe. The structure visible on the right side is right internal jugular vein and that pulsatile on the left side is right internal carotid artery. The vein is non-pulsatile and artery is pulsatile. This is confirmed by pulse wave Doppler. The waveform in the vein is non-pulsatile and venous flow, whereas the waveform in the artery is a pulsatile flow. This is the pulsatile waveform in the artery. This can be confirmed by color Doppler also. Now the operator starts the procedure. Now the operator is going to puncture the right internal jugular vein under ultrasound guidance. Now he has punctured and is getting a free flow of aspirate of blood. And with the hands still and the needle still, the operator is going to thread in the guide wire through the needle. Care should be taken that the needle should not be moved at any cost. Once there is an arrhythmia, further guide wire should not be threaded in. If needed, it can be removed a little bit outside. Now the needle is removed. To prevent soiling from the blood, a gauze piece is used at the puncture site. Now the guide wire is visualized inside the right internal jugular vein through the ultrasound probe. It can be confirmed that longitudinally also that there is no through and through puncture through the vein. A small nick is given at the skin. And the tract is dilated using a dilator. To prevent soiling, gauze piece is used. Now the central venous catheter is loaded over the guide wire. It should be made sure that the guide wire is coming outside through central port. And once the tip is visualized outside, then only the central venous catheter should be threaded in. After inserting the central venous catheter to the desired measurements, it is then flushed with the heparinase saline. All the 3 ports are flushed with heparinase saline and 3 ways are connected if necessary. And it is secured with a suture and a sterile dressing is done at the end and date is mentioned. Thank you everyone.